that experience was really hard. I mean, felt so isolated. I felt like I couldn't talk about it. Nobody was really bringing up the emotional and mental aspects of my pelvic floor dysfunction that I was feeling. I was a new mom. I was supposed to go back to work in 10 weeks. And I was just like, where are OTs in this field? Like, we need to be here.
The number of OTs providing perinatal care is on the rise, which is exciting and very necessary. There are still so many gaps in care for new and expecting moms, one of which is treatment for incontinence. As we'll see in the research we are looking at today, a staggering percentage of women experience postnatal incontinence, despite the known effectiveness of pelvic floor muscle training in addressing this issue. The article specifically explores the cost-effectiveness of various models of pelvic floor therapy. The main takeaway? It is more efficient to offer incontinence prevention services during pregnancy than it is to provide incontinence management services postnatally, and group-based treatment can be a particularly cost-effective method of service delivery for expecting mothers. To help us explore what it can look like to own a pelvic floor therapy practice, we're excited to welcome to the podcast occupational therapist Kyrsten Spurrier, owner of the Perinatal Pelvis. Let's dive in. Welcome to the OT Potential Podcast, where we review new and influential OT journal articles, then invite a guest to help us pull out actionable takeaways you can implement in your practice starting today. Welcome to the podcast. I'm your host, Carlin Reaume, OTD, OTRL. Before we dive into OT and perinatal pelvic health, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. Bearing in mind that this could count as a CEU course, I want to explicitly state our 2 learning objectives so you can be thinking about them throughout the podcast today. 1, you will be able to identify 3 clinically effective models of care to address urinary incontinence. And 2, you will be able to recognize the most cost-effective model of service provision for pelvic floor muscle training. So let's begin by looking at our journal article, and then we will bring on Kyrsten to discuss how this plays out in practice. The article we are reviewing today is called Group-Based Pelvic Floor Muscle Training for All Women During Pregnancy is More Cost-Effective Than Postnatal Training for Women with Urinary Incontinence. Cost-Effectiveness Analysis of a Systematic Review. It comes to us from the Journal of Physiotherapy, and it was published in 2021. A quick note on language. During this episode, we do highlight pelvic rehab for women to reflect the content of this article, but I wanted to acknowledge that pelvic floor rehab is an inclusive practice area for all genders. For the introduction of this article, they discuss postpartum urinary and fecal incontinence. Urinary incontinence and fecal incontinence refer to the involuntary leakage of urine or stool, respectively. Pregnancy and childbirth are significant risk factors for both types of incontinence. In fact, 33% of women experience urinary incontinence within the first 3 months after giving birth. In that same time frame, rates of fecal incontinence range from 3% to 29%. So what are the treatment options? Treatment options for both urinary and fecal incontinence include pelvic floor muscle training, lifestyle modifications, and training around bowel and bladder habits. Pharmacological and surgical treatment options are also available. However, these interventions are often associated with higher costs and greater risk for complications. Because of this, pelvic floor muscle training is recommended as the first line of action for managing incontinence. Boasting level 1 evidence to support its effectiveness, pelvic floor muscle training is recommended for a period of at least 3 months before pharmacological or surgical interventions are considered. But despite robust evidence supporting pelvic floor muscle training for the prevention and treatment of incontinence, there have not been any trials related to the cost-effectiveness of different models for delivering this care, which lead us to this paper. So what was the intent of this research? The specific research question for the study was, what is the most cost-effective way of providing pelvic floor muscle training, to prevent or treat postpartum incontinence. What were their methods? The authors completed a meta-analysis and a cost-effectiveness analysis of the pelvic floor muscle training delivery models that were included in a recent Cochrane systematic review. All pelvic floor muscle training trials included participants who were pregnant or within their first year post-pregnancy and who were looking to treat or prevent urinary incontinence or fecal incontinence. Pelvic floor muscle training was provided in individual sessions, group sessions, or a combination of the two. All treatments were delivered by physiotherapists. The outcome measures that they looked at for clinical effectiveness. In terms of outcome measures, the studies primarily used self-report assessment tools, including the following: Incontinence Impact Questionnaire, Urogenital Distress Inventory, and the Female Pelvic Floor Questionnaire. To calculate the financial impact associated with each intervention, the authors considered the following: healthcare service costs, including staffing hours, room use, and materials; consumer costs, including out-of-pocket costs, childcare, and lost work hours; and cost savings, including estimated reduction in pad usage. And so what were the results? This meta-analysis included 17 trials, and there were 3 models of care that were found to be clinically effective. Model 1, individually supervised pelvic floor muscle training during pregnancy to prevent urinary incontinence. Model 2, group-based pelvic floor muscle training during pregnancy to prevent or treat urinary incontinence. And Model 3, individually supervised postnatal pelvic floor muscle training to treat urinary incontinence and prevent or treat fecal incontinence. In looking at the cost effectiveness, the authors made 3 key comparisons when calculating the cost effectiveness of these models. 1, individual prenatal prevention is more cost effective than postnatal incontinence treatment. Number 2, group-based pelvic floor muscle training for prevention during pregnancy is a more efficient model than individual pelvic floor muscle training service after birth. And this holds true for groups of 4 or more participants. And number 3, group-based treatment during pregnancy can also be more efficient than individual prenatal care, again, as long as the group size is large enough. The math on this one was a little bit more complicated, so I will refer you back to the article for all of the details. Okay, so the discussion and recommendations. Given the clinical and cost effectiveness of preventing incontinence during the prenatal period, the authors set forth these recommendations. All continent pregnant women should have the opportunity to participate in urinary incontinence prevention services. It is more efficient to provide group-based prevention services to all women during pregnancy than it is to provide individual treatment sessions to incontinent women postnatally, provided that the group includes at least 4 women. However, the article also emphasized the value of treatment during the postnatal period should not be discounted, given its important role in the management of both urinary and fecal incontinence. Lastly, the authors pointed out that asymptomatic women need to be educated on the benefit of incontinence prevention in order to encourage engagement in prevention-based services. And health service providers must prioritize the prevention of incontinence by offering low-risk, cost-effective pelvic floor muscle training services. Therefore, incontinence prevention should be strongly supported by individual maternity care providers. There is so much to unpack from this article, and thankfully we have many pioneering OT practitioners who are opening practices in this area and who are providing this clinically and cost-effective care. And we are so thankful to welcome to the podcast an occupational therapist who provides pelvic floor therapy to her local community, Kyrsten Spurrier. Kyrsten is a pelvic floor therapist in Hillsborough, North Carolina. In 2021, she opened the Perinatal Pelvis. In her practice, she looks at the physical, emotional, and mental aspects of pelvic floor dysfunction and provides treatment that can integrate into a client's life. Her goal is to change the care and culture of maternal health in her community so that mothers truly understand that they deserve better care. So without further ado, I will patch Kyrsten into this podcast. Welcome to the podcast, Kyrsten. It's really great to have you here. I'm excited for our conversation today.
Yes, thank you so much for having me.
Of course. I'm really, really ready to dive in because pelvic health is a topic near and dear to my heart. And you can feel a lot of momentum around occupational therapy practitioners working in this space. And I know a lot of people are going to be really excited to hear some logistics around some of the practical pieces in putting a business like yours together. So let's go ahead and dive right in. I would love for you to tell me about how you got started in this practice area.
Oh man, it has been a journey. Actually, it came from my personal experience. So I had my first baby in 2017. Wonderful pregnancy, great delivery. I sustained a grade 2 tear, and as they repaired that, they actually misstitched me and stitched my rectum to my vaginal wall. And I did not know that at the time. So 10 days later, I was in extreme pain, and I really could not function at all. And I went in and they're like, well, you almost have a retrovaginal fistula. So almost like a hole through my vagina to my rectum. And you have to go into emergency surgery to repair it. And so I was like, okay, I'll do that, right? You don't have a choice. And that sent me into experiencing pelvic pain, urinary incontinence, fecal incontinence, and 1.5 years of pelvic floor therapy. And that experience was really hard. I mean, felt so isolated. I felt like I couldn't talk about it. Nobody was really bringing up the emotional and mental aspects of my pelvic floor dysfunction that I was feeling. I was a new mom. I was supposed to go back to work in 10 weeks. And I just was like, I don't know what to do. And so they were really looking at the strength, endurance, and muscle integrity of my pelvic floor and not everything else that comes along with it. And I was just like, where are OTs in this field? Like, we need to be here. And I just started searching for OTs that were doing pelvic health, and I connected with people internationally. I connected with a few people here in the United States and asked them, like, what courses do I need to take? What are you doing? Where can I be in this space? And that just set things into motion slowly. It was nothing fast. I was still working at a hospital at the time. And every single course that I took, I just felt a passion there. I felt like this is where I'm supposed to be. This is where I'm called to be. I don't exactly know when I'll get to use this, but I know this is what I will eventually do. And so I just kept going and seeing where it would come and when it would start to be relevant in my life. So that's how I really got into it, is little by little, but definitely through my personal experience.
Great. Thank you so much for sharing that story. I think a lot of us come to this work with similar but different, each unique experiences, but it's from some of the personal experiences and that our passion gets ignited around this work. So thank you for sharing your journey. I would love if you could tell me a little bit about your current practice with the perinatal pelvis.
Yes. So the perinatal pelvis is a cash-based practice, pelvic floor practice in Hillsborough, North Carolina. I mostly specialize in pregnancy and postpartum, but I definitely have outliers of that population as well. And I'm just really trying to create a space that women get the care that they deserve, and hopefully in time create a community that has better health care for women in my little town of Hillsborough, North Carolina. So I did not have this idea that I was going to start my own private practice. Like when I was going into pelvic health, I knew a lot of people were doing that. It was not like my first intention to be a, on my own type of therapist. I thought maybe it would happen in the long future. But actually when I started my practice, I had a 1.5-year-old and a 4-year-old. And what made the difference was honestly COVID. So I had my second baby. COVID hit when I was 7 months pregnant, and I had my second baby in May of 2020. And when I went back off of maternity leave, I was the primary OT on the COVID floor, and I worked the COVID therapy for 18 months. And I think in that experience, just seeing so much death and dying, I mean, I think everybody had it affect them in some way, but for me, it was just very in my face. Like, it wasn't people that I had done ICU care for the last 6 years, but to see these independent young people just trying to struggle to live, it just really brought home that life is too short to do something that you aren't passionate about doing. And I was getting burnt out. It was too much. It was affecting my health. It was affecting how I was mothering my boys. And I needed a change. And so I looked at the hospital first. I asked if I could go and do outpatient women's health. But at that time, then there were so many people coming inpatient. They didn't have enough need there because there was not very many people going to therapy due to COVID. And so I looked at other outpatient clinics and they weren't really hiring. And it just ended up being like, this is not the situation that I need to be in. This is not the situation I need to be in. And so I just took the jump and leap and was like, okay, we're doing this now. And so it's been a great adventure, but it definitely was really uncomfortable leaving a place that I was getting a salary and I was getting benefits to, I don't know, but we're just going to jump in with 2 feet and see where it takes us. So it's been great so far. I've almost hit 2 years and it's going well. So
congratulations on that milestone. And
Thank you.
2 years is significant. And, thank you for walking us through a bit of that journey. And certainly COVID caused a lot of changes, or I think pushed people to make changes that maybe wouldn't have occurred otherwise. So I appreciate hearing the way that you got into this. So I would love to know actually a little bit more about when you opened your practice, just kind of that feeling once you decided, okay, I'm all in, and you decided to step into it and just do it. How did you kind of sustain motivation for those initial phases? As you mentioned, you weren't feeling like you'd be a private practice owner necessarily. I'm just curious, as an entrepreneur, a new entrepreneur, what that was like for you, jumping all in.
I think I was so motivated not to go back. And I still am. I know that there's a lot of businesses that don't make it. And I would say I am not making what I was making at the hospital yet. It's not to that point. But I am so determined to not go back to the hospital full time that I was like, I will do anything. I will, try any marketing technique. I will make videos that push me out of my comfort zone. I will go and give flyers to all the doctors in the area, I think living through that burnout and I don't want to return to that it's given me enough motivation to just keep pushing forward.
Yes. I really find, given this work and the need in the community, I see that as such a driver, such a motivating force. Just speaking, from my perspective as a private practice owner as well, in those moments when I, question the next steps, I just really feel like it's bigger than me and it's such a need. And so that's helpful to have that motivation too around this work and being passionate about this care.
Oh, yeah. I mean, I would say that for sure too. It only took one patient, right? They're like, oh, because I came in with such this imposter syndrome of should I be here? And then it just takes one patient and they report, oh, this is so much better. I didn't ever have this before. And then another, and then another. And you're like, okay, this is something that's a high quality product that I'm providing for people and it's benefiting their life. So
yeah, absolutely agree. Thank you. So I would love to know, what were your impressions of this article?
Yes, I really liked this article because I think it demonstrates a win for everybody. I think there's been a lot of research on the importance of preventative care, which is awesome, like for multiple conditions, right? But then why aren't we doing that? Right? Like we still are getting stuck at providers like giving preventative care and like really showing the importance and really encouraging their patients to get preventative care. Also, I think that's hard to get it past like insurance companies paying for preventative care. So I loved how this article showed the cost effectiveness of it, of how it's not only gives women better outcomes, but it also gives a lot of savings to the healthcare system. And I don't know, working in a hospital healthcare system, I think the biggest takeaway that I saw is that people think that it's always for the patient. And I think it is for the patient, but also it has to make money. For their doors to stay open, they have to make money. So to do that, they have to provide the highest level of healthcare for the lowest cost to get the highest reimbursement, right? And so that's how they keep being able to survive in a community. It's just as simple as that. No matter what you think about healthcare, like that's bare bones fact right there. And so they need this information to show, look, you can still provide even a higher quality product and save more money and affect more women's lives in something like urinary incontinence, and like, how do we get this information out to those medical systems? And so that insurance companies practically cut costs or whatever if they get preventative care. Like that's where it needs to be, right?
Absolutely. Yeah, the bottom line costs are really what, people are paying attention to, or some of the, key stakeholders are paying attention to. And so exactly, a win-win. Yes, absolutely. So the article really focuses on pelvic floor muscle training to address incontinence. And, we've talked about how it really highlights the prevention, the preventative aspect. So can you speak a little bit about your holistic approach to treating pelvic floor dysfunction?
Yes. So I think occupational therapists have this wonderful role in what we could be doing for preventative educational, community educational services that I think we could even expand so much further than what we're doing now. Through my lived experience, I find that the pelvis is the storage house of like all of our unprocessed trauma and events and things that have happened to us. So I think when I have a client coming into my office, I feel like it's a great privilege to be invited into their beliefs and their trauma and their events that have happened to them that are impacting their pelvic floor dysfunction. And I don't take that lightly. I listen to what the patient is telling me, but I also listen to the body and what the body is telling me. And I think that is such an art, right? Like, it's not just, oh yeah, I want this service. It's no, like, what is your body saying and what are you saying? And are those meshing together? Because sometimes they aren't. And so bringing that together and helping the patient recognize, oh, this is what my body is saying, and I need to respect what my body is saying before I have any like internal pelvic floor work, for example. I start all of my patients off. We sit down, we discuss things, and then I say, what do you feel like your body needs today? And it's interesting because when they first start with me, they're like, well, I'm here for therapy. Like, you're the therapist. You know what I'll just do whatever you tell me to do. And as they continue care with me, I love it when they start saying, oh, this is what my body feels today. What could we do in that, right? So they're taking ownership of their body. They're recognizing that I'm coming along for their journey. And then where can I help in their journey of what they're experiencing? And I think that's just such a wonderful experience when that happens. And that I'm not coming in with my preconceived plan. I'm just like, okay, I take what the patient says for that session, and it can be totally different than the last session they had with me. And let's just see what's showing up today.
Yeah, that's why I really feel like occupational therapists are really prime people to do this work with our creative problem solving and the listening that we can do. And yeah, really meeting people where they're at that day, that moment, which might be different than what you thought, you were going to, or the kind of interaction you thought you were going to have with somebody walking in. Thank you for sharing that. It's making me think of a client I was working with as well recently who had a previous pelvic floor physical therapy experience. And we were checking kind of the coordination of some muscles, and I am very curious on people's own sense and connection with their body. And so I asked her a question like, well, what does that feel like for you? Or, something like that, trying to draw her into her body so she can feel what it feels like when muscles contract and relax. And she was like, well, I don't know, just what are you seeing? Like, are you seeing that they're coordinated? Or are you seeing, and I was going to provide her, I was going to share what I was observing, but it was hard for her to tap into and kind of trust her own felt experience of the body, so it's interesting. And we ended up, it was something that we were working on kind of ongoing, is her getting in touch with that to be able to say what she feels, what she needs. I agree with you. The pelvis is a space in the body where a lot of this comes up and it's, so vulnerable and intimate, and kind of being able to claim this is what I feel, or this, this is a sensation, or this is the experience I'm having. And then having a therapist meet you there and support you in that process is really powerful. Yeah.
Well, and that disconnection, right? Like, I don't think we're ever taught how to connect into that space until usually there's dysfunction there. And so how we go about that is just so interesting in terms of holding space for what they've gone through, but also trying to build that connection and that awareness. It takes time.
Absolutely, it does. It does. I feel so passionate about, just general education around all things pelvic health, right? Because it is something we never really talk about, so I'm glad we're having this conversation today. So can you tell us a little bit more about some of the group-based offerings? Since that was such a focus of this exciting article, I would love to hear kind of what you're doing with the perinatal pelvis around group-based work.
Yes. So I would say I did not start the perinatal pelvis thinking that I was going to be running all of these group things, but that's what we're doing. So I started because I was coming off of COVID. And I had all these moms coming into my office just feeling so isolated and not having any community. And I was like, well, I'm trying to meet these moms where they are and be a part of their journeys, and I want to help them. So let's make a hangout group. So I made like this group on Meetup called Nurturing Mom of Hillsborough, and where moms could just like connect with each other. I tried every month to run a hangout group or an educational class that just really is like a little bit of education, but mostly, hey, moms and babies can come and you can meet each other, because people were so desperate for connection coming off of COVID. And then I didn't open my practice and like the floodgates of people came in. It was really slow going. I have very little providers coming and giving me referrals. So I found that as like a marketing strategy, that in my little town, I could host group classes for $15 a class, and people could come get some education kind of feel out if this is something that they need more of. They could ask their questions and get a sense of, okay, this is what pelvic floor therapy is. Because I feel like I have a lot, I think everywhere, that people just don't know what pelvic floor therapy is, or if it is appropriate for them to go to pelvic floor therapy unless they're referred. And the problem is medical providers are not referring. So we have to close that gap of, no, these are the things that would qualify you and you'd be a good candidate for pelvic floor therapy. So I started there. I would say I've kind of evolved as my group-based offerings are how my patients are coming back and sharing what they need. It really is how I've evolved that part of my practice. So I've now moved into more collaboration work that I'm doing Saturday workshops with 4 other providers that we do 6-hour intense workshop about the first 6 weeks postpartum. And you get pelvic floor therapy, mental health, yoga, nutrition, and mental health, all of those things that we're all kind of coming together. And those people that come to that class then have 5 providers that they know what we do and they can be supported in their postpartum time. I'm also running some support groups because I feel like I'm starting a birth trauma support group. I had a lot of moms this summer that delivered and had some birth trauma. And they're like, we'd love to have a support group. Awesome. Let's create one. And so it's really listening to what my patients are coming back and telling me and then trying to fulfill those needs. And I do it for as long as the need is there. And then if the need changes, I change with it. For a while I was like, oh, I have to keep doing this. I'm like, no, this can evolve. It can change however I see fit, And I would say the other thing I've been doing since day one is vendor events, which is a little interesting, but it's going into the community and putting up a table. This last weekend, I was at a barbecue event. And it's okay, why would pelvic floor therapy be at a barbecue event? Well, because my community is at a barbecue event. Moms are at barbecue events because there's bounce houses and face painting. And the conversations that you get at those are just so interesting. There's some people that are like, oh yeah, I know that. Awesome. There's other people that have never heard of pelvic floor therapy and they just want to talk and talk and talk and be like, okay, you have to tell me everything that I need to be doing. Really, I would say in the older female generation, they have no idea. And they're like, well, can I still get this? Is this too late? And so I feel like showing up and educating people by just having a booth out has been great. I mean, it's so much fun to be able to feel like I am providing a service to my community, and hopefully in time that will impact the care that they're receiving from pregnancy, postpartum, and way beyond. So
absolutely. And I love how you describe just certainly being receptive to the needs of the community, but then you stepping up and saying, okay, look, I hear you that this is a need. I'm going to figure it out. And I think that speaks to jumping in maybe even before you're ready. You know what I mean? There can be a tendency for us to feel like a lot of other occupational therapy practitioners that I speak with where it's okay, let me make sure I have everything in place before I do XYZ. But there's an element of all of this where it's okay, no, you have such a strong foundation. You will figure it out. And yeah, you really have shared some really powerful examples of how you've done that in your work. So that feels really inspiring to hear that. So I would love if you could share with us a memorable story about a client that stands out to you in this work as an occupational therapist.
Yes. So I have actually 2 stories because one I think is just so funny. 2 weeks ago, I had a patient come in with her partner, and I do a pregnancy like prep bundle. And one of the sessions, they come in and the birthing partner comes in as well, and learns education, different birthing positions, and just is able to ask questions. And I really tried to like say this is really important if they don't have a doula, just to kind of explain the role of a birthing partner. And he was sitting there and just like, okay, so I just have a question. Can I get pelvic floor therapy? And I was like, oh, yes. Men can get pelvic floor therapy. Everybody has a pelvis, there's male-specific pelvic floor dysfunction. I personally do not see men, but I have some referrals. If you want to get somebody, I can refer you. He's like, oh, no, I don't have any pelvic floor issues. Just my wife feels so much happier after she comes to you that I just thought that maybe I could come and it would work for me too. And I was like, okay, I don't think it's going to have the same effect, but thank you so much. So it was just really sweet. But probably my most memorable was I had a patient that saw my sign. She had just moved to the area when I was like 3 months into starting my practice, right? So I was just like new, not really knowing what I was doing. And she had 3 to 4 other pelvic floor therapists, diagnosed with endometriosis, had 3 different surgeries, 5 miscarriages. And she came into my practice with a medical binder like that thick. And I was just, talk about imposter syndrome. I was like, what in the world am I going to do? After talking to her, she had to quit her job because she was in so much pelvic pain and she was a nurse and she couldn't do her job. She was vomiting 3 to 4 times a week because she had so much muscle spasming that it would just make her vomit. She used to be a yoga instructor, couldn't get through a yoga practice. She used to be a hiker. She couldn't carry a backpack through the airport anymore. Just every single part of her life and function and just being was being affected by this. And so I was like, I don't know what to do, right? In this medical binder, she had every single test in the book. She told me of all these pelvic floor things that she had done. Half of them I did not know. I was just like, I don't know. And so I was like, okay, let's start with breathing because I know how to do breathing. Let's do breathing, right? It was so amazing. She had never had a pelvic floor therapist even focus on breathing. And she was a yoga instructor. She's like, I know breathing, but I had never brought this into my pelvic floor work. And I was like, oh, okay. So we did breathing for a long time. We got that down and she started like feeling better. And then we started working on energy conservation and let's not do a full yoga practice. Let's do 5 minutes. Let's do 5 minutes 3 times a day. And can you do that and still feel fulfilled in your yoga accomplishments, right? Or will that help you get off the couch? When you feel fatigued, let's not push yourself. Let's take a break. Different ways to carry a backpack, different, things that you can be doing. Like, can you go on a walk that has no hills for a while? And so all those things we just started chipping away at week after week. And she just so trusted me with her care and her journey. She just was like, this is working. We're doing this. I'm getting better. And so she ended up being able to like hike 2 miles, carrying a backpack. She ended up getting pregnant and carrying to term, and she just had her baby boy. So I saw her this weekend and she's like carrying in a wrap her little 6-week-old baby. And it's just wonderful. It's like, this is what we do, is we come alongside people and meet them where they are. And we just do occupational therapy. Like, I didn't know all the things. We just break it down for them, right?
Yes, exactly. Thank you for sharing that beautiful story. I do think that perfectly illustrates so much of the foundation that we have as occupational therapists is relevant and powerful in pelvic health. And so I think sometimes that, some people see a barrier. Oh, I feel like I don't have specialized knowledge yet, and they're hesitant to jump into pelvic health. But yeah, you have so many tools already. And then you continue to build on that with additional specialized trainings. But yes, returning to the breath, energy conservation, breaking down habits, routines, that's really beautiful. Thank you for sharing those stories with us. I would love to know what one of the biggest lessons is that you have learned in your journey as a private practice owner thus far, or a barrier that you've overcome. What can you share with us?
I would say patience overall. Like, I thought I was a very patient person coming into this, but it's totally different when you don't have a salary coming in and you need to make money and nobody's calling you. And you're like, okay, what do I do? I just sit here and I wait. Like, how do I show people? Like, I never had this huge feeling like I wasn't giving good care. Like, I felt pretty confident that I was giving good care, but that's not the issue, right? Like, a lot of people give good care. It's showing others that it's important for them to receive that good care, right? And so, and that it's needed in their life to improve their function and their quality of life. And so, yes, there was many times I was like, did I make this huge mistake by having this great idea and then nobody coming, and learning, nope, this is the ebb and flow of a startup business. I need to practice some meditation for myself and find where success lies, I guess, of what is valuable to me. And then what can I do on the back end of my business to help it get going instead of just sitting and twiddling my thumbs. But it was definitely, there's times I'm like, I'm sitting in an empty office for 6 hours a day. What can I do? So finding those projects then of what is going to make things work for me and make this more of an automated practice, right? So those downtimes is when I started an email list or newsletter, or created some free resources that I put on my website or worked on my website. And then those aren't giving me immediate income, but knowing that they still have value. And so changing kind of what is valuable for my time, because as a regular, like not regular, but as a OT in a hospital system, I was paid for doing therapy. And now changing that mindset of doing therapy sessions is only one piece of what I'm doing as a part of my whole practice. I'm doing community outreach. I'm running a business. I'm, connecting with other providers. I'm marketing. So all of those different things, and learning how to get value in that for myself, really, is just like that mindset shift.
Absolutely. That's huge. The mindset shift of knowing, I hear that you know your worth, like you know your worth, you know your value, you're providing something really important to your clients and to your community. And I think that also comes up when you mentioned, the event, the barbecue event and the bounce houses, and the more kind of conversations that you have with people who might be coming to your table because they're intrigued, or might be staying away from the table because they're like, I don't want to talk about my pelvis or whatever it is. I feel like the more that we just talk about this in our communities, it opens up doors. And maybe not right then in that moment is that person going to follow up with this booking appointment, but it's very possible that they will then, the next time their friend is talking about leaking, when they sneeze or whatever it is, they'll say, hey, did you know there's this person in our community? So I really think that's, important to share your value loud and proud within the community. And you're really setting a great example of doing that.
Yeah, it's so interesting. I had a patient start with me about 3 weeks ago. And I was like, so I ask everybody, like, how did you hear about me? Because it's like, I want to know. And she's like, oh, I got your card at last year's, it's called Hillsborough Hog Days, at last barbecue event. I wasn't pregnant at the time, so I just kept your card for almost the entire year. And then when I got pregnant, I called you up.
That's
was like,
awesome.
yes.
Mm-hmm. See, planting the seeds and, having that patience. It's great. So what do you think has made you successful as a practice owner thus far? And kind of what does success mean to you? Certainly patience is part of that recipe. I'm curious what else you would say to people that are out there thinking about private practice.
Yeah. I mean, I think success to me now is just trying to be the best I can be in my skills. And that's not necessarily taking all the classes ever, but learning, hey, where are my loopholes that I need to get better at depending on my client population, right? Like what my clients are presenting with, and then going and finding more skills to help them. And then trying to figure out how to really change women's health in my community. I want to be known as the practice that moms recommend moms to, like that is all this. If you get in on the mom group, right, you're golden. Yeah. So that's what I want to be. I want to be the mom name for pelvic health in my community. I want them to understand that they deserve to have better care and that there is better care out there. I get a lot of bounce backs from other pelvic floor therapists, and they're like, oh, I didn't even know there was a difference of pelvic floor therapy. I never knew I needed to ask these questions of my pelvic floor therapist. And so I feel like right now we're doing so much work in everybody needs to know about pelvic floor therapy. And we also need to transition to what makes quality pelvic floor therapy depending on what symptoms you're having, and giving these women the words to interview their therapists.
Yes.
And knowing no, you want somebody that is trained like this or has done these trainings, for example, or this education. Logistically, I would love to continue to grow and thrive in this business. I want it to make it that I can continue to do it financially. And so therefore it needs to grow to a certain point for my family to be sustained. But I think success is really just being a part of these women's lives and coming alongside them and seeing the change that I'm making in their family systems as well.
That's so powerful to have those experiences and feel that impact, that radiating impact that you can have as a therapist. So certainly, what additional supports or resources would you recommend that other people interested in pursuing private practice in pelvic health might explore? What are the things that you see as really valuable supports and resources in this area?
Yeah. So I would say I know there's a lot of students that are starting to become really interested in this field. And if you are one of those, I would say definitely take OT-based pelvic floor courses. There's starting to be quite a few of them out there that are excellent. And then ask questions about what other courses you should be taking. Join the Facebook groups. There's a few of them now. And connect with the leaders of the pelvic floor OT world. I think all of them are so amazing and always have open doors to ask questions and have a direction. I feel like it's such a supportive network of OTs that have been created. It's great. And then the two biggest things that have definitely got me to where I am today is one is accountability. So in 2020 at a Herman and Wallace course, I connected with another OT, and she was in another practice area as well. She was in school systems and I was in the hospital, but we both had this goal of working in pelvic health. And we're like, we're going to do this someday. And I remember Lindsay Vestal just saying like, oh, I had accountability when I was coming through. And I just thought it was really inspiring, like really impactful, right? And so I called this other OT up a few months later because I had my baby and I was on maternity leave. But I called her up and I was like, hey, do you want to be my accountability partner? And she was like, sure. And so we committed to calling each other once a week. And first it started out as just talking through case studies. We talked about the muscles of the pelvis. We kind of quizzed each other on different courses that we had taken. It evolved into writing our resumes and figuring out how to set up LLCs. But anytime that we started questioning, like, are we just crazy? We had the other person being like, no, we're doing this. We are doing this. It might take us a long time, but we are doing this. And so then comes to find, it's now been 3.5 years and we both have our own private practices. And we still talk once a week. And so now we talk about difficult cases that are coming into our practice. We talk about how we want to advance our practices and have become really good friends. So we go to a lot of courses together and figure out just where we should be going in our own journeys, but obviously like supporting each other. So shout out to Marlene Handler in Brooklyn, New York, because she has definitely helped me get to where I am today. We both say we probably would not be here with the demands of life and being moms if it wasn't for each other. So that's been monumental in getting me to where I am. The other was I had a lot of courses in pelvic floor therapy, but I didn't really realize that I should be taking courses in business. And so I started my business and then I was like, I don't know how to run a business. So I had some help with marketing courses that have really been huge in helping me set up my practice and making it that I'm not working all the time, but that there's some automated stuff that's happening behind the scenes when I'm not there to keep people connected into my practice. So that's been huge for me. I would say if you're a pelvic floor therapist and not yet doing pelvic floor therapy, I would say yes to everything. Even if you're uncomfortable, like I'm not always comfortable in every single thing that I've said yes to, but I've been invited to do some really cool things that I would have never expected, like speaking at a junior league or being a part of a Hillsborough barbecue event or, just any of those things, going to the library to talk to a mom's group. Whatever it is, you just say yes to all of it. And then when you become to a point that you are thriving and everything like that, then you can be picky. But for now, and this is probably something my husband says to me a lot. It's like, until you're making what you want to make, you can't be picky. You just say yes to everything. And you make all the connections and you don't know where those connections will happen. I've made some connections with people that I'm like, oh, I was at a coffee shop. Okay, and then it starts coming back to you and people are asking you to come and do things instead of you trying to get in at other places. Like I definitely tried to call different hospitals or clinics to say, hey, could I come provide you a class or could I come give a workshop, right? It's you putting yourself out there and making that happen, not thinking that they're going to always invite you. And the last thing is imposter syndrome. I think we talk about it a lot in the pelvic health world because there's so few of us, but kind of like how my patient showed, like, you don't have to know all the answers. You don't have to have all the courses. All you have to do is be an OT. So as long as you can work on breathing and posture and roles and routines and holding space for listening, healing can occur. If you touch the pelvis or not, healing will occur. And so I think kind of getting out of our own head to think that we're going to have all the courses before we start our own private practices. I personally had only hands-on experience from my in-person classes or courses that I did. I wasn't able to do any mentorship or anything like that before starting my own private practice. So I went from a hospital-based setting straight into private pelvic floor therapy. So it was not like I practiced on tons of people before I started. I just went for it. And yes, there was gaps, but I figured it out. And there's a huge community that can help you. So
amazing. Thank you so much for sharing all of that. You just went for it, and it's awesome. So I would love to hear, as we wrap up here, I can't believe our time is coming to a close, but what do you feel like your ideal vision is of occupational therapy in the world? And what do you think it will take to make that happen?
Well, it's going to take a lot of work, but I think my ideal vision is that OT is the golden standard for perinatal care. I think we show through what we can do on the prevention and education side. The care that we can provide, I think, is unmatched with any other profession in terms of through pregnancy and delivery, postpartum, and way beyond that. I think to get there, it's going to take starting education at high school and showing the importance of pelvic floor therapy, and then having women advocate for themselves that they deserve this care throughout their entire life. So I have a lot of women that come into my office and they say, well, how long do I have to do pelvic floor therapy for? And then when is it that I don't have to think about this anymore? And I would say that right there is showing that we've done you a disservice, because we should have at puberty told you that you have a pelvic floor and that this is a new responsibility. This is a part of your body that now you are responsible for, and you should have ownership of this part of your body. Here are the tools to take care of this part of your body so that you can maintain it. And pelvic floor therapy is for those people that need those tools in their toolbox. And so, but right now, nobody has those tools given to them, right? So they're coming to pelvic floor therapy not even knowing that they have a pelvic floor or what their pelvic floor is made up of, instead of thinking of it like, oh, I know what my pelvic floor is. I just need a little help. And so I tell people it's like hair appointments. There is a part of your life that you learned that you have to take care of your hair. It's not anybody else's responsibility. And if you leave your hair to go and do its own thing, it's going to be a hot mess, right? But if we give you the tools of teaching you how to use a hairbrush and shampoo and conditioner and going and getting it cut or going and getting it colored, whatever you do for your hair, and you maintain it, it's fine, right? So we need to make pelvic floor therapy the same way. Here are your tools, you use your tools, and it's fine. And instead of, oh, we have to chop off the hair, right? So that's the kind of the idea I give people, is that I think that's the mindset shift that has to eventually happen, is educating women early enough that they have ownership of this part of their body.
Yes, absolutely. Just like a haircut. I know all people should think about it just like haircuts, right?
Just like haircuts.
Absolutely.
And then you just like check in, you know? It's not like you have to like always go and get your hair done.
Right.
But you should check in every so often.
Exactly. Thank you so much, Kyrsten. Thank you for sharing a little bit about your journey and your practice with us today, talking about all of this important work. It has been such an honor to have a conversation with you about all of this today, and I look forward to seeing what the future holds for you in the perinatal pelvis. So thank you.
Well, thank you so much for having me. It was wonderful to be here.
What an awesome conversation. I really found it inspiring to hear Kyrsten's story. I loved hearing her heart for helping her clients, and also how openly and candidly she talked about what it takes to get a private practice off the ground. To go along with this episode, OT Potential will be launching a pelvic floor therapy guide and directory. So if you are a pelvic floor therapist, we highly encourage you to join our OT Potential directory so you can be found here. This is also a great resource for fellow occupational therapists to find others who are interested in this area. And if you are interested in earning a CEU certificate for your time today, what you're going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, thank you so much for joining us today. I hope this podcast helps keep you informed and inspired as an occupational therapy professional. Take good care, and we'll talk next time.